Hey there people. In this video on child health, we are going to talk about coronavirus, COVID-19, in babies and kids, symptoms and what you need to know. The coronavirus, COVID-19, continues to disrupt our lives. After a few fleeting summer months of seeing infection rates decrease in many parts of the world, we're once again seeing a worldwide surge in transmission. What hasn't changed is the number one thing you can do to protect yourself and family. Stay away from sick people, skip large gatherings and gatherings with family and friends who do not live with you, and take everyday preventive measures against spreading germs such as washing hands and covering coughs. The CDC lists fever, dry cough and shortness of breath as predominant symptoms but notes that infected children don't initially present these symptoms as often as adults. Fatigue, nasal congestion, sore throat and gastrointestinal issues, such as diarrhea and nausea, can also be symptoms. Children currently represent 11.5% of all COVID-19 cases in the US. While symptoms are often milder than in adults, children can be severely affected, particularly infants, if they do get infected. If you think that you or anyone in your family may have the virus or has been exposed to the virus, call your doctor. If you're worried about what's happening and what's to come, you're not alone. Aside from getting basic supplies and handling childcare, parents are also sorting through the precautions they can take to protect themselves and their families, including social distancing. They're also figuring out how to process this ongoing global event with their children. How can I protect my family? The Centers for Disease Control and Prevention, CDC, recommends that families take common precautions known to help prevent the spread of infections. These include hand washing. Encourage children to wash their hands often with soap and water for at least 20 seconds, especially after going to the bathroom, blowing their nose, coughing, or sneezing. If you don't have access to soap, alcohol-based hand sanitizer, as long as it's 60% alcohol, will suffice. Avoiding sick people. Keep kids as far away as possible from anyone who is coughing or sneezing. Cleaning and disinfecting high-touch surfaces. These include tables, hardback chairs, doorknobs, handles, light switches, toilets, and sinks. Washing plush toys. Follow manufacturer's instructions. Launder on warmest recommended setting, and dry completely. Wear a face mask in public settings. The CDC recommends wearing simple, non-surgical cloth face coverings in all public settings, such as supermarkets, where other social distancing measures are difficult to maintain. Face coverings should not be worn by children under 2 years old or anyone not capable of removing them on their own. Practice social distancing. What is social distancing, and what does that mean for my family? To slow the spread of the virus, and to prevent a scenario where medical facilities become overwhelmed because of a sudden spike in sick people, experts are recommending that everyone take steps to reduce close contact with others outside their immediate family. Think of it as physical distancing instead. Social distancing doesn't mean you have to lock your family in the house, but it does mean weighing physical interactions with others carefully, staying away from large crowds, especially indoors, and making sometimes uncomfortable changes to your family's activities, holiday celebrations, and plans. Even though kids are at lower risk of getting seriously ill from the coronavirus, it's important to remember they could potentially spread the virus to someone more vulnerable, such as an elderly relative or medically fragile schoolmate. By taking individual precautions, we can help protect others. There is currently some debate over exactly how to implement social distancing on an individual level, and official guidelines lack specifics. In general, expert advice includes: avoid large gatherings of people. As COVID-19 numbers continue to rise, it's a good idea for families to stay clear of social gatherings outside of your immediate family. The advice on playdates is changing almost as fast as case counts. Follow local advice to protect your family. When it comes to school and daycare centers, both the risk mitigation efforts and safety guidelines will be dependent on local transmission rates. Consult your district administrators and local health authorities for more information. Get outside, just keep your distance. You and your kids still need fresh air and exercise. It helps reduce stress and bolster the body's immune system. Just try to keep at least 6 feet between your family and others. Consider going for a hike, or playing catch together at the park, only if you can maintain distance from others. Minimize trips to closed-in areas, indoor playgrounds, trampoline parks, museums, and other places where people gather in close quarters are best avoided. Germs spread more easily indoors. Obviously, some trips are unavoidable, such as going to the grocery store, but try to go at times when there will be fewer people, and don't bring your children if you can safely avoid it. And remember to wash your hands before you go and when you return. Consider limits on eating out. A large number of states have ordered bars and restaurants to cease all operations other than serving takeout meals. Speaking to CNN, Dr. William Schaffner at Vanderbilt University School of Medicine in Nashville recommended avoiding crowded establishments, and considering ordering to go or takeout. But Dr. Asaf Bitton, a primary care physician and executive director of Ariadne Labs who wrote in Medium, said cooking at home is safer. He suggests buying restaurant gift cards for later use to support local businesses. Connect digitally with friends and family members. The New York Times suggests using FaceTime or Skype to check in with grandparents and friends who may be feeling isolated. Your kids could also chat with their friends online, or do parallel activities together over FaceTime such as coloring or playing with Legos. These measures may sound difficult, even extreme. However, this is not forever. If everyone does their part now to help slow the spread of COVID-19, we can save lives and improve our chances of returning to a normal routine sooner rather than later. Symptoms of coronavirus in babies and children. Coronavirus symptoms in babies and children are similar to those in adults. The difference is that children typically have milder symptoms than adults. They can include runny nose, cough, fever or chills, muscle pain, sore throat, difficulty breathing, vomiting and diarrhea, in rare cases. Who is at risk? While people of every age are at risk, so far, this coronavirus has proven to be most severe to the elderly and those with pre-existing illnesses. Relatively few children are known to have contracted the virus, and those who have tested positive typically had mild symptoms. Because this virus is still so new, we still don't know whether some children may be more at risk for serious complications from the coronavirus, such as those with underlying medical conditions or special healthcare needs. Reports of rare clusters of COVID-19 exposed children and adolescents being admitted to intensive care units with acute multi-system inflammatory conditions have researchers working overtime to collect more data and fully understand causality. If you live in the United States, your family's risk of being exposed to coronavirus is directly related to the rate of transmission in your immediate community. Cases of COVID-19 and community spread are being reported in all states and are expected to increase as the outbreak expands. There are several maps available to help you pinpoint COVID-19 case locations. Among the clearest is the New York Times map based on CDC data. What should I do if I think my baby or child has the coronavirus? Stay home and call the doctor for medical advice if you, your baby, or toddler, develop coronavirus symptoms, and you think you've been exposed to the virus. For example, if you've recently traveled to an area where COVID-19 is spreading, or you've been in close contact with someone who has COVID-19. It's important to call ahead so your healthcare provider can take steps to prevent others from becoming infected or exposed to the virus if you or your child need to go into the clinic for an appointment or testing. Call 911 if you or anyone in your family are experiencing the following symptoms: difficulty breathing or shortness of breath, persistent pain or pressure in the chest, new confusion or inability to arouse, bluish lips or face. What we know about the coronavirus COVID-19 is so new that there is much we don't know about how the virus works and how it spreads. Here's what we do know. Symptoms can be mild, especially in children. Coronavirus symptoms are indistinguishable from other common respiratory illnesses. Some people with coronavirus don't show any symptoms at all. Others develop pneumonia, which can be life-threatening. It has both deadly and mild-mannered relatives. The virus is new, but it's part of a family of viruses that originates in animals and is known to sometimes be deadly to humans, such as severe acute respiratory syndrome, or SARS, another coronavirus that killed almost 800 people in the early 2000s but has since disappeared. However, some coronaviruses aren't very dangerous at all. Health authorities are still trying to figure out exactly how deadly and contagious COVID-19 is compared to other coronaviruses. One estimate is that about 16% of people develop serious illness from COVID-19, but new estimates are appearing as additional information is gathered. So far, the US, India, and Brazil have the highest number of reported infections, but cases have been recorded in 218 countries and are still spreading widely and rapidly in many of them. The coronavirus cases are approaching 78 million around the world, and these numbers are expected to keep rising. If you want to know the latest numbers and distribution of cases, see the CDC, the World Health Organization, or the New York Times COVID-19 map. Most of the deaths are of older folks with underlying health problems. US cases are increasing. Currently, more than 18 million people in the US are confirmed to have coronavirus, a number that is expected to continue rising as the virus continues to spread. More than 330,000 people are reported to have died. Health authorities are carefully monitoring those who are sick and doing everything in their power to stop the disease from spreading. Currently, the number of COVID-19 cases in children represents 11.5% of overall case counts in the US. Knowing how to handle your child's questions and fears while you may be feeling anxious yourself can be hard. If you're struggling as a parent to explain what's going on in the world, you're not alone. It's important to be open about the coronavirus with your kids. As the CDC says in its guidance on talking with kids about COVID-19, parents, family members, school staff, and other trusted adults play an important role in helping our children make sense of what they hear in a way that is honest, accurate, and minimizes anxiety or fear. Here are some tips to help your little ones keep all the worrisome news in perspective. Don't dismiss your child's fears. While it's important not to plant fears in their minds that they don't already have, it's equally important to recognize and honor that they may be feeling anxious about what they've heard about coronavirus, either at school, on the news, or from friends. Ask them what they know and what they don't understand. Sometimes children may not mention things they're afraid of, but that doesn't mean they're not worried. It's always a good practice to allow kids the opportunity to talk about what scares them. Clear up misconceptions. Plenty of rumors and myths about the origins and details of the virus are circulating, such as how you catch it, the risk of catching it, and what happens if you get sick. It's important to share the truth with your kids and clear up misinformation. No, this isn't an Asian thing. No, eating garlic won't prevent COVID-19, etc. Like with most topics and kids, the honest answer is the answer that will give the most comfort. A child can tell when you're beating around the bush or bending the truth. You can be prepared to clear things up or field the questions by being informed. Assure them that adults are working to keep us all safe. There are loads of reports available highlighting all the measures that are being taken to try to contain the virus and to ensure everyone is as prepared as possible should the virus not be contained. Sometimes children need to be reminded of this. Turn the TV and news off. The 24-hour news cycle can be upsetting to children, especially since the tone of most news is dramatized and focuses more on what has gone wrong and much less on the positives. Stay calm. Kids aren't the only ones affected by the news. If you're feeling panicked about the potential for an outbreak and all the scary unknowns, do everything you can to process your anxiety in healthy ways. Do your best to stay positive and confident in the presence of your children. Don't underestimate the power of hugs and cuddles. Nonverbal reassurance can go a long way. Older kids, especially, may not know to ask for physical reassurance, so pay attention to cues that it's time for a good, reassuring hug, or cuddle on the couch in front of a funny movie or good book. Teach them to wash their hands properly. 20 seconds is the magic number, using soap and warm water. Hand sanitizers that are at least 60% alcohol are a good hygienic supplement as well. You can't tell if someone has coronavirus by looking at him, the same way a surface can look and feel clean but still have germs on it. So stress basic hygiene and practice it with them. The coronavirus story will continue to evolve over the days ahead. Your kids will hear more about it from all angles. Being there for them with a willing ear, clear information, and love will help them, and help you weather the storm. Staying informed about the latest developments involving COVID-19 can help you continue to protect your family. For more information, see the New York Times, the CDC, and the WHO for consistent updates on the situation. Baby Center understands that the coronavirus pandemic is an evolving story and that your questions will change over time. We'll continue asking moms and dads in our community what they want to know, and we'll get the answers from experts to keep them and you informed and supported. Hi there viewers. In this video we are going to talk about, do children still get measles? But before that, take some time to hit that subscribe button if you haven't yet. Okay, let's get into the topic. Do children still get measles? Unfortunately, yes. Measles is an extremely contagious and potentially deadly viral illness. Any child who has not received the measles, mumps, and rubella (MMR) vaccine or the MMRV vaccine, a combination of the MMR and varicella, or chickenpox vaccine, is susceptible to catching the disease. From January 1 to May 17, 2019, there were 880 confirmed cases of measles in the United States. This includes 24 states and is the greatest number of cases reported in the United States since 1994. This outbreak was caused primarily by unvaccinated travelers who became infected with measles while visiting countries where measles is widespread. When they returned to the United States, they exposed unvaccinated people in their area to the virus. Other contributors to the outbreak are groups of people who decided not to vaccinate, for religious reasons or based on misinformation about the safety and effectiveness of the MMR vaccine. Before the measles vaccine was introduced in 1963, about 3 to 4 million people in the United States were infected with the disease each year. Of those, 48,000 were hospitalized, and 400 to 500 died. After the vaccine program began, the number of measles cases was reduced by 99%. Even so, measles outbreaks still occurred in this country. Between 1989 and 1991, for example, 55,000 cases of measles were reported, with 123 deaths. These were mostly unvaccinated preschool children in urban areas. In 2000, measles was considered eliminated from the United States, but then the numbers began to creep back up. In 2011, 220 cases of measles were reported, and in 2014, 667 cases were reported. From 2015 through 2018, 766 people in the United States came down with the illness. Most of those infected had traveled to foreign countries or lived in communities with pockets of unvaccinated people. Measles still occurs all over the world. According to the World Health Organization, an estimated 7 million people worldwide were affected by measles in 2016. And more than 95% of measles deaths occur in countries with low incomes and weak healthcare systems. What causes measles? Measles is caused by a type of virus called a paramyxovirus, and it's very contagious. When someone who has the virus sneezes or coughs, tiny droplets containing the virus spray into the air. The droplets stay active for 2 hours in the air or on a surface. A child who breathes in these droplets or comes in contact with them can become infected. If your child isn't immunized and he hasn't already had the disease, he has a 90% chance of getting infected if he's been exposed to the virus. Someone with measles is contagious for 4 days before and 4 days after developing the telltale rash. What are the symptoms of measles? After a child has been infected, the first signs of measles will appear in about a week to 12 days and usually involve cold-like symptoms. Fever. An extremely runny nose. Cough. Red, runny eyes. Low energy. Poor appetite. A few days later, she may develop characteristic spots in her mouth, particularly on the mucous membranes that line her cheeks. These spots, called Koplik spots, appear as tiny white dots like grains of salt or sand on reddish bumps. A couple of days after that, a measles rash appears on the child's face at the hairline. It then spreads downward to the neck, back, and trunk, then to her arms and hands, and finally to her legs and feet. The rash starts out as flat red patches but eventually develops some bumps. As the rash appears, the fever usually climbs, sometimes reaching as high as 105 degrees Fahrenheit. The rash may be itchy. A child with measles may also develop croup, nausea, vomiting, or multiple swollen lymph nodes. The cough may become troublesome, and the child will feel miserable. The rash usually lasts about 5 days, and as it fades, it turns a brownish color. It fades in the order it appeared on the child's body and leaves the skin dry and flaky. Most children have symptoms for about 1 to 3 weeks. What are the possible complications? Otherwise healthy children usually recover from measles just fine, but about 30% of people with measles develop 1 or more complications. Complications are more likely in children younger than 5 years old, pregnant women, adults age 20 and older, and those with compromised immune systems. According to the Centers for Disease Control and Prevention, CDC, for every 1,000 children who get measles, 1 or 2 will die from it. Complications include ear infections, which can result in permanent hearing loss. Diarrhea. Pneumonia, which is the main cause of death from measles in young children, affecting as many as 1 in 20 children with measles. Encephalitis, which is a swelling of the brain that can result in deafness or intellectual disability, affecting about 1 in 1,000 children with measles. In addition, in pregnant women, measles can cause miscarriage, premature birth, or a low birth weight baby. What should I do if my child has been exposed to measles? If your child has just been exposed to the measles virus and has been fully immunized, received 2 doses of the MMR vaccine, it's extremely unlikely that he'll come down with the measles. Still, contact his doctor if he develops symptoms. Talk with the doctor if your child has been exposed to the virus but has only had 1 out of 2 MMR shots. If he had the first shot after his first birthday and it was 1 or more months ago, the doctor may give him the second shot right away, for added protection. Some states will still require another dose after a child's 4-year birthday, if the second dose was given before then. If your child has been exposed but hasn't yet been immunized, call his doctor. If it's been 6 days or fewer since exposure, the doctor may suggest an immune globulin injection to help prevent measles from developing or at least make the symptoms less severe if they do show up. If your child is 6 months old or older and it's within 72 hours of exposure, the doctor may also recommend 1 dose of the MMR vaccine. He'll still need to receive 2 more doses of the vaccine on the recommended schedule, at 12 to 15 months and another at 4 to 6 years. How should I care for a child with measles? If you suspect that your child has measles, call her doctor right away. Don't go to the office or emergency room without calling ahead, because you don't want to expose others to the virus. There's not a lot you can do to treat measles other than try to make your child more comfortable. These tips might help your little one feel better. And remember to keep your child away from others so she doesn't spread the illness. Make sure she gets plenty of rest and fluids. Run a cool mist vaporizer to help with the cough. For fever and aches, give your child the proper dose of ibuprofen, if she's 6 months or older, or acetaminophen, if she's 3 months or older. If your child is younger than 3 months, check with a doctor before giving her any medication, even an over-the-counter pain reliever. Never give your child aspirin, it can trigger Reyes syndrome, a rare but potentially fatal disease. Note: once your child's healthcare provider confirms that your child has measles, the provider is required to report it to the state health department, which in turn reports it to the CDC, to track and prevent the spread of this contagious disease. Is there any way to prevent my child from catching measles? Yes. The MMR vaccine, which protects your child against measles, mumps, and rubella, is about 93% effective at preventing measles after 1 dose and 97% effective at preventing measles after the second dose. If your child has missed any scheduled immunizations, check with a doctor about an updated schedule. When should my child get the vaccine? The first dose of the MMR vaccine is routinely given between 12 and 15 months of age. Before your baby's first birthday, the antibodies he received from you at birth may interfere with his ability to initiate a strong reaction against the vaccine. In the meantime, he has some protection against measles from antibodies received from you in the womb. The second dose of the vaccine is usually given when your child is between 4 and 6 years old. There are a couple of situations in which your child can receive the vaccine before his first birthday. If you're planning to travel overseas with your baby and he is 6 to 11 months old, his doctor will give him 1 dose of the MMR vaccine before leaving. If he's 12 months or older, she'll give him 2 doses of the vaccine, at least 28 days apart. The doctor may also give your baby a dose of the vaccine if there is a local outbreak and he's between 6 and 11 months old. If there's an outbreak in your area, your local and state health departments will provide recommendations, and your child's doctor can advise you on what to do. Is the measles vaccine a live vaccine? The MMR vaccine is what's called a live attenuated vaccine, a live virus that's been weakened so that it won't cause the disease in your child. Instead, the virus will replicate in the cells of her body and cause her to produce an immune response, which should protect against infection when she meets up with a real measles virus. The vaccine is the best way to prevent this illness. Some children develop a mild rash and fever after the vaccine, but it's uncommon and only lasts a few days. That's all what we got for now. Comment below and let us know about your baby. Hit that like button to help us reach more audience to spread this knowledge. So see you later. Bye for now. If no one gets these diseases anymore, why does my child need to be immunized? Unfortunately, there are still outbreaks of these highly contagious diseases, and some can lead to serious, even life-threatening complications. Cases of measles, mumps, pneumococcal disease, and whooping cough, pertussis, continue to appear in the United States with alarming frequency. From January 1 to December 31, 2019, for example, the CDC confirmed 1,282 cases of measles in the United States. The number of cases surpassed that of the last outbreak in 2014, which had the greatest number of cases reported in the US since measles was eliminated in 2000. Babies and young children are particularly susceptible to these diseases, which is why we start vaccinating at birth. For example, before the Hib vaccine became available, Hib disease was the most common cause of bacterial meningitis in babies and children. Hib meningitis once killed 600 children a year in the United States and left many of those who survived deaf, with mental disabilities, or susceptible to seizures. Since the introduction of the Hib vaccine in 1987, the incidence of Hib has declined by more than 99%. Diseases can reappear even though many of the other diseases we vaccinate for are rare. If we take away the protection given by vaccination, more and more people will be infected and will gradually spread these diseases to others. Soon we'll undo the progress we've made over the years. We know this because it happened. When measles vaccination rates in the United States dropped in the late 1980s, more than 50,000 people, mostly children, were hospitalized with the disease and 120 died from it. In 1998, when immunization rates were back up, only 89 people became sick from measles and no one died. And it's happening again. Vaccination rates are dropping and we're seeing measles outbreaks across the country. Other diseases such as polio and diphtheria, though almost unheard of in this country, are still only a plane ride away. Even if you and your family never leave the country, many people do, and they can unwittingly carry these diseases back with them. So if you choose not to vaccinate, you'll have to be sure not only that your child doesn't travel, but also that he's not going to be exposed to others who have traveled. Even rare diseases can reappear. If not enough people were vaccinated against diphtheria, for example, we might end up with a situation similar to what happened in the former Soviet Union. With the breakdown of the public health services there, fewer people were vaccinated and diphtheria epidemics began to occur. Between 1990 and 1999, there were more than 50,000 cases and 5,000 deaths from this once rare disease.
Allergies more likely in kids given antibiotics as babies. Babies given antibiotics during the first 6 months of life could be at heightened risk for developing allergies later in childhood, according to a new study. Parents should avoid giving antibiotics to children unnecessarily. The research, published in JAMA Pediatrics, doesn't prove that antibiotics given to infants cause allergies, only that there's an association between the two. Antibiotics can be life-saving, so don't hold off on giving your baby antibiotics if your doctor says she needs them, such as for a bacterial infection. But make sure your baby doesn't take antibiotics unnecessarily, the researchers recommend. Viral infections, such as the common cold, don't respond to antibiotics, so there's no point giving them to your child if she has a virus. Researchers analyzed the medical records of almost 800,000 children enrolled in a healthcare program for military families between 2001 and 2013. About a fifth of the children were prescribed antibiotics by the time they were 6 months old. These included the following types commonly prescribed to babies: penicillin, penicillin with B-lactamase inhibitor, cephalosporin, sulfonamide, and macrolide. Later in childhood, the children given antibiotics by 6 months old were more likely than the kids not prescribed antibiotics as babies to be diagnosed with allergies, the study found. Allergies diagnosed included food allergies, anaphylaxis, asthma, dermatitis, hay fever, and allergic conjunctivitis. Asthma was most strongly associated with the use of antibiotics in infancy, lead researcher Dr. Cade Nillen said. Also, the more different types of antibiotics prescribed to the children by 6 months, the greater their risk for allergies, the researchers concluded. Antibiotics interfere with bacteria in the gut. They kill bacteria that cause infections and also kill good bacteria that help the body fight disease. The researchers speculated that, in babies, this could leave children more susceptible to allergies. Additional research is needed to figure out whether antibiotics can actually cause allergies, however. It's possible that the connection can be explained differently. For example, maybe children who develop allergies are more likely as babies to get bacterial infections that require antibiotics. Speaking with CNN, Dr. Purvi Parikh, an Allergy and Asthma Network spokesperson who was not involved in the research, agreed that parents should be cautious about giving children antibiotics. If a child truly needs an antibiotic for a bacterial infection, they should not withhold it due to fear of allergic disease, she said. But, one should not overuse antibiotics if not needed, for a virus or a cold, as there may be long-term consequences from overuse. Confused about when to take antibiotics and when not to? Test your knowledge of what antibiotics won't cure. Also, here are 5 questions to ask your doctor before giving your baby antibiotics.
What are hives? Hives, also known as urticaria or welts, are swollen, often itchy areas on the skin. They can show up in different shapes and sizes, but they're usually well defined, with a pale, raised central area surrounded by a red border. Hives are common. They typically last for a few hours to a few days, but it's possible to have them for months at a time. They aren't contagious, but they may spread on the skin. They may disappear from one area of your child's skin only to crop up elsewhere. What causes hives? Hives occur when the body releases a chemical called histamine. There are so many possible reasons for hives that you may have trouble identifying the culprit. Here are the most common ones. Insect bites and stings. If your child is allergic to bees or fire ants, for example, he could develop hives in reaction to being stung or bitten. Food. A child might get hives in reaction to something he eats. The most likely foods are milk, eggs, peanuts, tree nuts, such as almonds, walnuts, or pecans, soybeans, wheat, fish, and shellfish. Certain food additives and preservatives can also trigger hives. A child may break out in hives because he's allergic to the protein in the food or because his body reacts to a chemical in the food by releasing histamine. Some children even develop hives simply from coming into contact with certain foods, for example, when the juice from a strawberry gets on their skin. Allergens. If your child has an allergy to cats, for example, he may break out in hives when he touches a cat. A child may even develop hives in reaction to an allergen in the air, like pollen. Illness. A child might get hives when he has a cold or other viral infection. These hives usually last for a week or two before disappearing. Less commonly, he may get hives when he has a bacterial infection. Temperature. Cold temperatures sometimes cause hives. The same goes for a sudden change in temperature, such as when a child's skin warms up after being cold. Drugs. Antibiotics and some other medications might cause a child to break out in hives. How should I treat hives? If you think your child has hives because of a pet or pollen allergy, give her a bath to rinse away as much of the allergen as possible. Cool compresses and cool baths sometimes provide relief. You might also try dabbing the hives with calamine lotion on a cotton ball. Avoid dressing your child in clothing that's snug in the area where she has hives. If hives are making your child uncomfortable, ask her doctor whether you can give her the appropriate dose of an oral antihistamine to reduce itching and swelling. When should I call 911? Call 911 immediately if your child has hives along with any of the following. Respiratory symptoms, such as wheezing or shortness of breath, swelling of the face or tongue, unconsciousness, difficulty swallowing, dizziness or lightheadedness along with hives. These symptoms can signal anaphylactic shock, a potentially fatal allergic reaction. If your child is still a baby, keep in mind that a baby's respiratory system is so tiny that even a small amount of swelling can make it very difficult for him to breathe. When should I call the doctor? Call the doctor if your child is younger than 2 years old and has widespread hives, more than one location. In addition, call the doctor if a child of any age gets widespread hives after a sting or in reaction to medicine or food, has hives and seems very ill, has a fever, lethargy, nausea, persistent vomiting or crampy abdominal pain, for example, has swollen hands, feet, or joints. Also talk with your child's doctor if the hives last more than a week. While most hives don't require special attention, chronic cases may call for skin testing for food or drug sensitivities, blood tests for underlying diseases, or, uncommonly, a skin biopsy. If you've given your child an oral antihistamine, according to your doctor's advice, and she's still not comfortable, or if the antihistamine seems to make her too
Hi dear friends, in this video we are going to talk about animal bites. What should I do if my baby gets bitten by an animal? That depends on how bad the wound is. If it's clearly minor, nothing more than a superficial scratch, carefully wash the area with soap and water. Apply an antibiotic ointment twice a day. Cover your baby's wound with an adhesive bandage if it's on a part of his body that's likely to get dirty. Otherwise, leave it exposed to the air. If the skin is broken and bleeding, the injury may be serious. Apply a gauze pad or clean cloth to the wound and press with your fingers. If pressure doesn't stop the bleeding in a couple of minutes, call 911 for emergency medical care. Animal bites to your baby's face or neck are especially dangerous because they may open up major blood vessels. Even if the bleeding stops, call the doctor right away to determine whether your baby needs stitches or other medical treatment. Animal bites are more likely to become infected than other types of cuts, so the doctor may prescribe a round of antibiotics. Should I worry about rabies? Most dogs and cats in the United States are vaccinated for rabies, so they don't carry the virus that causes the disease. If you know who the owners of the animal are, ask them to provide documentation that the animal has been vaccinated. You can call their veterinarian for verification, if necessary. If you don't know who the owners are, or the animal is acting strangely or foaming at the mouth, try to keep the animal in your sight, but don't go near it. Call your nearest animal control authorities to come and capture it. You can find the number in your telephone directory. Animal control authorities can check the animal for signs of rabies. If you don't know the animal and are unable to follow it, animal control can attempt to find the animal and its owner to check on its rabies status. If you can't verify that the animal's rabies vaccinations are up to date, your baby will probably need a series of shots to prevent rabies, just in case the animal does have the disease. In addition to unvaccinated dogs and cats, wild animals such as raccoons, skunks, foxes, coyotes, and bats can carry rabies. If a wild animal has bitten your baby, call your doctor immediately. If rabies is a possibility, your child will need a series of anti-rabies shots. Something else you should know about bats: your baby can get a rabies infection from a bat scratch or very small bite, small enough that you may not even be able to detect it. For this reason, it's important to take your baby to the doctor if he touches a bat or if you discover that there was a bat in his environment, in a camping cabin or near his playpen outdoors, for example. Call animal control to pick up a bat that may have exposed your baby to rabies if it's still in the area or has been killed. Small household pets like gerbils, hamsters, guinea pigs, and white mice don't carry rabies, though bites from these animals can become infected. Small wild animals, like gophers, mice, rats, chipmunks, rabbits, and squirrels, are considered low risk for rabies. What about other infections? While you may worry most about rabies if your baby is bitten by an animal, a bacterial infection is a much more common problem. That's why it's so important to wash the area thoroughly and apply an antibiotic ointment. If the wound is serious or it's in a spot where there's a high risk for infections, like your baby's face, hands, feet, or genital area, even if it's minor, the doctor may prescribe antibiotics. For any wound, even a minor one, your baby may need a tetanus shot if he's not up to date on his immunizations. And you'll want to keep an eye on the wound over the next few days, even if it's superficial and you treat it at home. If the wound begins to look infected, red, swollen, or oozing, or your baby starts to run a fever or act sick, call the doctor right away. Also see your baby's doctor promptly if the bite doesn't heal in 10 days. How much of a problem are animal bites? Far and away the most common bite is a dog bite. Each year, 800,000 Americans get medical care for dog bites, and half of these are children. More boys than girls get bitten, and almost 2/3 of the injuries among children under age 4 are to the neck and head area. So it's important that you take precautions to protect your baby from animal bites. What can I do to prevent animal bites? When your child is older, you can teach him the basics of avoiding animal bites. At this stage, it's up to you to protect him from animals. Never leave your baby alone with your pet or anyone else's pet. Almost half of the children who are bitten by dogs received the bite from the family's dog or a neighbor's dog. And remember that any dog or cat may bite if provoked, by a baby pulling its tail or acting aggressively, for example. Okay, that's all what we got today. Comment below about your funniest or dangerous experience with any animals. Leave a like to help us reach more people to share our knowledge. Make sure you've subscribed to our channel. See you later. Hello everyone. My baby has a spotty red rash all over her chest. Oh. Could it be chicken pox? Well, it could be. Because most babies get antibodies against the virus from their mother while in the womb, it's unusual for a baby to come down with chicken pox during the first year. Those who do tend to have a mild case. Chicken pox, also called varicella, typically causes an itchy rash that starts out as small red bumps. These bumps quickly change into clear, fluid-filled blisters on a pink base, which eventually become dry brown crusts. New waves of blisters often spring up as the illness progresses. The rash often appears first on the scalp, face, or trunk. It can then spread over the entire body. Children usually get between 250 and 500 blisters, although it's possible to have just a few. Your baby will probably be tired and slightly feverish. She may have a loss of appetite and, for a couple of days before the rash appears, a mild cough or a runny nose. Chickenpox usually lasts 5 to 10 days. How did my baby get chickenpox? Chickenpox is caused by the varicella zoster virus, which passes from person to person with remarkable ease. If your baby has been exposed to the chickenpox, it usually takes 14 to 16 days for the pustules to appear, although they can show up anytime between 10 and 21 days. People with chickenpox can pass the virus along by touching someone after touching the blisters or coughing or sneezing onto their hand, or by releasing it into the air whenever they sneeze, cough, or even breathe. The virus can also spread from direct contact with the fluid from the blisters before they crust over. Is chickenpox dangerous? For healthy babies, chickenpox is usually more of a nuisance than a real threat. On rare occasions, though, even healthy children can develop serious complications from chickenpox, like a bacterial skin infection, pneumonia, or encephalitis, a swelling of the brain. If your child has chickenpox, call the doctor if she seems sicker than expected, if she develops a fever after the first few days, if the rash spreads to her eyes, or if the skin around the pox becomes swollen, painful, or very red. If your child has a weakened immune system from a chronic illness such as leukemia or from taking high-dose oral steroids, for asthma, for example, the infection can cause grave complications. Some special protective measures, such as an injection of varicella zoster immune globulin or the varicella vaccine, can only be useful shortly after exposure. If your baby's immune system is compromised, call her doctor at the first sign of chickenpox, or even if she's only been exposed to someone who's sick. Adults who come down with chickenpox can get very sick and are at risk for such complications as bacterial pneumonia. If you're pregnant and have never had chickenpox, read our article on chickenpox during pregnancy and ask your doctor what precautions you should take and what to do if you've been exposed. What are shingles? The same virus that causes chickenpox can cause a painful rash called shingles. When a child has chickenpox, the virus remains in the body and can reappear as shingles many years later. This happens to about 1 in 10 adults who had chickenpox earlier in life. Is there any way to prevent chickenpox? Yes. A vaccine has been available since 1995, and the American Academy of Pediatrics, AAP, recommends that most children receive the shot at 12 to 15 months of age, with a second dose at 4 to 6 years. The vaccine causes few side effects in healthy children and keeps more than 95% from getting a serious case of chickenpox. The shot isn't recommended if your child has had a severe allergic reaction to gelatin, yes, the stuff that makes Gelor hold together, the antibiotic neomycin, or, when she's older, a previous dose of the vaccine. If your baby has cancer or any disease that affects her immune system, has recently had a blood transfusion, or is taking high doses of oral steroids, her doctor will carefully evaluate whether receiving the vaccine would be a good idea. How should I treat my baby's chickenpox? Keep your baby home from daycare until all the sores have crusted over to prevent her from spreading the disease and to give her time to recuperate. Unfortunately, children are most contagious the day or two before the rash erupts, usually before parents know their child is sick. While your baby's recuperating, the most comforting thing you can do is relieve the itching. Give her a cool bath every 3 to 4 hours. Sprinkle baking soda or colloidal oatmeal, made specifically for the bath, into the water for added relief. You can also use uncooked oats. Tie them in a cheesecloth bag and toss it in the tub. After the bath, put calamine lotion on the itchy spots. It may seem like an impossible task, but try to keep your baby from picking and scratching her sores, which can slow the healing process. Sores that aren't allowed to heal can leave scars or lead to skin infections such as impetigo. Keeping your baby's nails short can help. Bring down your baby's fever with the proper dose of acetaminophen. Never give aspirin to your child as it can trigger Reyes syndrome, a rare but potentially deadly condition. If your baby seems really uncomfortable, you might ask her doctor about giving her an over-the-counter children's antihistamine to help reduce the itching. Doctors can prescribe an antiviral drug called acyclovir to treat chickenpox, but it's not generally recommended for otherwise healthy children. For children with weak immune systems, however, acyclovir can be crucial. That's all what we got today. Leave a like and a comment about your baby. Make sure you've subscribed to our channel and ring that notification bell. See you in the next video. Hey there amazing people, as always in this video, we are going to talk about an important topic about your children. So in this video we are going to talk about bee stings in children. But before we go into the video, make sure you've subscribed to our channel and rang that notification bell. Okay, let's begin. If a bee or wasp stings your child, remove the stinger as soon as you can and apply ice. Allergic reactions are rare, but watch for swelling and other signs. Make sure children wear shoes outdoors to avoid being stung if they step on a bee. What should I do if a bee or wasp stings my child? What should I do if a bee or wasp stings my child? A bee's stinger works like an automatic pump. The longer it stays in, the more venom it releases, so get it out as quickly as you can. Take these steps. Look for a little black dot in the center of a reddened area and scrape it off with a fingernail or credit card. Try not to squeeze the stinger with your fingers or tweezers, because that could release more venom. Once you've removed the stinger, wash the area with soap and water. Elevate the area, if you can, to reduce swelling. Apply an ice pack, wrapped in a cloth, for 15 minutes to minimize swelling and relieve pain. If you don't have an ice pack, grab a package of frozen vegetables, or drop a few ice cubes in a plastic bag. To soothe the area and draw out some of the venom, apply a paste of baking soda and water. Simply dab it on, let it dry, and rinse it off. For pain, you can give your child acetaminophen or ibuprofen. If your child is really uncomfortable and he's at least 6 months old, the doctor may recommend an over-the-counter children's oral antihistamine to help relieve itching and swelling. The pain usually begins to go away after a few hours, although the swelling may increase for another day or two. In the meantime, continue to apply ice, if your child will let you. When to call the doctor for a bee sting? If your child was stung many times. Multiple stings can be dangerous, even if your child doesn't have an allergic reaction. Venom from numerous stings can cause vomiting, diarrhea, headache, and fever. If the sting is in your child's mouth, this can cause dangerous swelling that might block her airways. Take your child to a healthcare provider or the ER immediately. If the swelling continues to increase after 2 days, or if swelling in a hand or foot spreads past the wrist or ankle, even if your child was only stung once. The area where your child was stung develops red streaks, yellowish fluid, or is becoming redder. The doctor may prescribe antibiotics to combat infection. Can bee stings cause dangerous allergic reactions? On rare occasions, a child will have a severe allergic reaction to a sting. This is called anaphylactic shock, and it can be deadly. Call 911 immediately if you notice these signs of an allergic reaction within a few minutes or hours of the sting: swelling of the skin, lips, throat, tongue, or face. Wheezing or severe breathing problems. Rapid or weak pulse, or irregular heartbeat. Hives. Dizziness, fainting, loss of consciousness. Nausea, vomiting, abdominal cramps, diarrhea. Extremely pale skin, sweating, or blue skin color confusion, slurred speech. How can I protect my child from bee stings? Unfortunately, insect repellents don't protect against bees and wasps. But there are some things you can do to minimize your child's chances of being stung. Don't use perfumed soaps or toiletries on him, because the scent will attract bees. Dress him in light-colored, solid fabrics rather than dark, brightly colored, or flower-printed clothing, which attracts bees. Make sure your child wears shoes when playing outside, because people are often stung when they step on a bee. Be especially alert when you're near blooming flowers or orchards, which attract bees. Teach your child not to swat at bees and wasps. Teach her to walk away. Bees and wasps are not very fast. Keep dishes of food covered when you're outside. Repair any torn screens in your windows and doors at home. Consider using netting around your child's crib or bed if bees or wasps are finding their way indoors. You can also use netting over your child's infant seat, playpen, backpack, or stroller when you have her outdoors during bug season. Destroy beehives and wasp nests around your home. That's what we got today. Comment below your childhood experience with bees. Leave us a like to show your love. See you next time. Hi there wonderful people, as always today we have an interesting yet informative video about your baby. So in this video we are going to talk about broken bones. How can I tell if my baby has broken a bone? Making this determination on your own can be difficult, but chances are the bone's not broken, just sprained. Babies' bones are so pliable they rarely break. If your baby's injury only swells a little bit and he doesn't seem to be in much pain, it's alright to treat the injury with ice and wait a day or two before calling the doctor. If the swelling goes down and things seem to be on the mend, it was probably a sprain. But if the injury doesn't improve or gets worse, it's time to take your baby to the doctor for an exam. Of course, if you're really worried, or you don't know the extent of the injury, you should err on the side of caution and see the doctor. Here are some other warning signs of a broken bone: a snapping sound, bruising, tenderness to touch, severe pain, especially in one spot, increased pain with any movement. Don't assume that if your baby can move his limb or digit it's not broken. That's an old wives' tale. Stiffness, limping or the inability to stand or walk, for a child who can walk, refusing to stand or walk a limb that seems bent or out of position. What if I can see a bone protruding from my baby's skin? If your baby is in an accident that causes bone to pierce through his skin, call 911. If you also suspect a neck, back, or skull injury, or get him to an ER right away. This type of break is called an open fracture. Because of bleeding and the risk of infection, it is the most dangerous type of break. Don't touch it for any reason, even to wash it. To lower the risk of infection, drape the open wound with a clean cloth diaper or sterile gauze and either call 911 or proceed to the nearest emergency room immediately. What should I do if I think my baby has broken a bone? The best thing you can do is protect and immobilize the injured area, making sure your baby doesn't worsen the damage. Comfort your baby, and get medical attention right away. If you suspect a skull, neck, back, or pelvic fracture, don't move your baby. Call 911 immediately. In other cases, call your healthcare provider. If your baby has a non-life-threatening fracture, your doctor will likely tell you to bring him to the office or to the emergency room for an exam, and possibly x-rays, and give advice on how to move him safely. Don't give your baby anything to eat or drink, as it may cause a delay in medical treatment. If the bone needs to be reset or your baby requires surgery, doctors will have to wait to give him anesthesia until his stomach is empty. And never attempt to straighten or change the position of a dislocated joint or broken bone. You could make the injury worse. You'll also have to be on the lookout for symptoms of shock or internal bleeding. Call 911 or go to the nearest emergency room immediately if your baby has visible head, chest, or abdominal wounds, or if he has any of these symptoms: a weak, rapid, or irregular pulse, clammy or bluish skin, rapid, shallow breathing, confusion or loss of consciousness, coughing up or vomiting blood. How do I know if it's safe to move my baby? Unless you suspect a serious injury to the head, neck, or spine, it should be fine to move him. But if your child has a bad break, it's important to immobilize the injured bone or joint first. This will minimize any further injury and will make moving your baby easier. The method you use for protecting the injured area depends on where the injury is. What should I do if I can't get medical help right away? Over-the-counter children's pain remedies such as acetaminophen and ibuprofen can help ease the pain. Other than that, follow the ICES approach: ice, compression, elevation, support. Here's how. Ice decreases pain and swelling. If you don't have an ice pack, wrap some ice cubes in a dish towel or plastic bag and crush them with a hammer or by banging them on the kitchen counter. Or simply grab a bag of frozen veggies from the freezer and wrap it in a towel. Hold the ice pack against the injured area for at least 20 minutes, 4 times a day. Compression decreases swelling. After you've iced the injury, wrap an elastic or fabric bandage around the hurt limb. It should be snug but not tight. You should be able to stick one finger between the bandage and the skin. Check the tightness frequently. If the limb continues to swell, the bandage could become painful. Elevation decreases pain and swelling. If you can get your baby to lie still, place a pillow under the affected limb so that it's elevated approximately 6 inches above his heart. Support helps immobilize the limb and reduces pain. Put a splint on the affected limb. If you suspect a broken arm, rib, or collarbone, use a cloth or diaper sling to hold the arm in a bent position next to your baby's body. How do I immobilize a suspected broken bone if I can't get medical help right away? If your baby has a bad break, your best bet is to call 911. The paramedics will know the safest and most effective way to immobilize your baby's injury and move him to the hospital. But if 911 isn't an option, you're camping, for example, use whatever is on hand to create a simple splint. For example, you can use a ruler, paper towel roll, small firm pillow, rolled up coloring book, or any other straight, firm object. Make sure the splint is slightly longer than the bone and joint you're supporting. Wrap the supporting item with a diaper or soft cloth to protect the skin, then use handkerchiefs, belts, strips of cloth, shoelaces, bandanas, or ties to tie it in place, without moving the injured limb, at the joints above and below it. If your baby's lower leg is broken, for example, you'd tie the splint at his knee and ankle. For a fractured collarbone, place the arm on the injured side in a sling, and tie the sling around the shoulder on the opposite side. If you can move your baby without putting him in much pain, skip the splinting stage and just bring him into the emergency room or doctor's office. Immobilization is most important for severe injuries and when a trip to the ER could take hours. What specific advice can you give for a broken arm, wrist, or hand? Start with the ICES approach outlined above. Then, if the hand or upper arm is injured, make a sling to support the arm. Fold a large piece of cloth into the shape of a triangle. Gently slide the wide part of the triangle under the injured arm. Tie the two long loose ends around the neck. Make sure the sling is tied tight enough to hold the arm snugly. If a bone in the forearm or wrist is fractured, use a folded newspaper or magazine padded with a towel or small pillow to create a splint that immobilizes and protects the broken bone. Place the lower arm into the splint, supporting the injured area. Tie the splint around the arm using cloth strips on either side of the break. After securing the splint, make a sling to support the arm. What specific advice can you give for a broken finger? Raise the finger above the level of your baby's heart to help minimize swelling. Apply a cold compress for 10 to 15 minutes. Then splint the broken finger by placing a piece of cloth or cotton between the injured finger and an uninjured one and taping the two fingers together. What specific advice can you give for a broken leg? Follow the ICES approach described above, then, if the injury is below the knee, make a splint. Boards or sticks work best. If they aren't available, you can use a blanket. Place one board on the outside of the leg, extending from hip to heel. Place the other on the inside, extending from groin to heel. Pad the boards with blankets or pillows to protect the leg. Then tie the boards in place at the groin, thigh, knee, and ankle using cloth strips. For a blanket splint, roll up the blanket and place it between your baby's legs. Then tie the legs together at the groin, thigh, knee, and ankle. If the injury is to the upper leg or hip, don't move your child unless absolutely necessary. Call 911 for help. If you must move your baby, make a splint with boards. One board should extend from your child's armpit to his heel. The other should reach from groin to heel. Pad the insides of the boards with towels or pillows, and tie them in place with cloth strips at your child's chest, waist, groin, thigh, knee, and ankle. That's all what we have for now. If you have had a fracture when you're young, share that story with us in the comments. Like this video if you have gained some knowledge from here. Make sure you've subscribed to our channel. See you all later in another video. Bye for now. Can getting more than one vaccination at once overload my child's immune system? No, studies show that getting multiple vaccines at the same time is safe. A child's immune system is well equipped to handle the antigens, or immune triggers, contained in multiple vaccines, according to overwhelming scientific evidence. Children's immune systems are stronger than you think. They're designed to protect kids from the hundreds, even thousands, of foreign bodies they're exposed to each day in the form of fungi, parasites, bacteria, and viruses. In fact, children are exposed to more antigens in the environment every day than to those in all their vaccinations combined. And because of innovations in the way vaccines are made, today's vaccines contain far fewer antigens than those administered in the past. The research health experts have been sufficiently concerned about the safety of getting multiple vaccines to provoke extensive research and analysis. They've tested theories such as whether overloading the immune system with vaccines could weaken a child's defense against infection or trigger an autoimmune disease such as type 1 diabetes. They've also examined whether the large number of vaccines in today's recommended schedule exposes children to too many antigens at once, possibly triggering allergies or asthma. Here's a summary of just a few of the studies. National Academy of Medicine Study, 2002. The U.S. Centers for Disease Control, CDC, and National Institutes of Health, NIH, commissioned the National Academy of Medicine, NAM, formerly known as the Institute of Medicine, to study the question of whether multiple vaccines could harm a child's immune system. The report found no evidence of a connection between multiple vaccines and increased infection or autoimmune disease. If there were, experts said, the rate of infection and diabetes in vaccinated children would be higher than in unvaccinated ones, and that doesn't appear to be the case. National Academy of Medicine Study, 2013. This involved a rigorous review of scientific findings related to the immunization schedule for children. Again, the Academy found no evidence of any safety concerns associated with getting vaccines on time, including multiple vaccines. It did find a benefit. Children who got vaccines according to the recommended schedule were less likely to get vaccine-preventable diseases. A University of Louisville study published in 2010 found that young children who receive multiple vaccines in the first year of life are no more likely than children who had fewer vaccines to have any developmental problems. In fact, the infants who were fully vaccinated performed better in some areas of brain development than the group with delayed immunizations. This is very reassuring news for those parents who worry about vaccines. A 2018 study in Journal of the American Medical Association, JAMA, gathered medical data on almost 1,000 children between ages 2 and 4. Researchers found that higher amounts of exposure to antigens from vaccines did not increase children's risk of getting sick from infections not targeted by the vaccines. Several studies show no connection between vaccines and allergies and asthma. These include a controlled study in the 1990s involving more than 18,000 children that found vaccinated kids do not have higher rates of asthma than unvaccinated children. For more information on vaccine safety studies, check out this comprehensive list from the American Academy of Pediatrics. The real threat. When children don't get vaccinations on time, there's a very real concern about infectious disease. A child's immature immune system isn't capable of fighting off serious and potentially fatal diseases such as measles and meningitis. That's why it's so important for your child to be vaccinated early. Weighing the very real risk of contracting one of these diseases against any possible risk from the vaccines makes it clear that the benefits of vaccinating your child far outweigh the risks.
What are pet allergies? Pet allergies occur when a person develops an immune reaction to animal dander, skin flakes, saliva, urine, or feces. Animal fur or hair itself isn't much of an allergen, but it can trap pollen, dust and mold, which can all be allergens. When a child with pet allergies breathes in dander or comes in contact with saliva or droppings, his immune system goes on alert and releases histamine and over 40 other chemicals designed to fight off the allergen, prompting symptoms such as sneezing and watery eyes. Any animal with fur or feathers, including dogs, hamsters, guinea pigs, birds, and especially cats, can cause a reaction in a child who is allergic. Even hairless or short-haired dogs and cats can cause allergies. However, some children with pet allergies are more allergic to certain breeds or even individual animals. Pet allergy symptoms in babies and children. Common signs and symptoms of pet allergies include runny nose, itchy, watery eyes, sneezing. Symptoms such as coughing or wheezing, itchy skin, raised, red patches on the skin, hives. When do pet allergies show up in babies and children? Pet allergies can develop at nearly any age, but they typically don't cause symptoms prior to 2 years of life. A common cause of congestion and sneezing in newborn babies is actually lint particles from new clothes and bedding. Nasal saline, gentle bulb suction, and washing all of your baby's new materials may help. What are the chances my baby will be allergic to my dog or cat? Anyone can develop a pet allergy. However, your child is more at risk for developing a pet allergy if she has a strong family history of allergies or asthma, has other allergies or allergy-related diseases such as asthma or eczema. How can I tell whether my child is allergic to our pet? Your child may be allergic to the family pet if her allergy symptoms are year-round, as opposed to seasonal. Although this could also be a sign of an allergy to dust mites, cockroaches, or mold. Your child's symptoms ease after she's been away from home, and your pet, for an extended period, such as a family vacation. Your child's symptoms get worse when she's playing or snuggling with the family pet. Advertisement page continues below. It can be hard to figure out whether or not your pet is responsible for your child's allergies. Removing your dog or cat from the house for a test period won't tell you much, since there will likely be enough pet dander in your home to trigger your child's allergies even when your pet isn't around. Even after leaving home without your pet, your baby may still have a reaction because chronic exposure and symptoms, once triggered, can occur for days after the exposure is removed, according to allergist James L. Sublett, past president of the American College of Allergy, Asthma, and Immunology (ACAAI). Allergens will likely be transported to the new environment on clothing and other items, he said. You may need to take your child to an allergist to find out for certain whether or not your pet is causing the allergy symptoms. Diagnosing pet allergies in babies and children to determine allergy triggers, your child's doctor will likely ask about your child's symptoms. Examine your child's nose and throat to look for inflammation. Refer your child to an allergist for allergy testing. An allergist may perform the following tests. Skin prick testing involves pricking the surface of the skin with a small amount of liquid allergen. After 15 to 20 minutes, the allergist looks for bumps or welts, like small mosquito bites, that indicate an allergic response. This is the #1 choice for initial allergy testing. Serum testing involves a blood draw to measure the body's antibody levels for specific allergens. It is not as accurate as skin prick testing, but it is the preferred method for children with certain skin problems or who take certain allergy medications on a regular basis. What's the best way to treat pet allergies in children? In general, the best way to avoid allergy symptoms is to avoid the allergen itself. When your child's allergy is severe, your family might consider removing the pet from the home. If your pet is already an important member of the family, other options are available. If you do decide to remove your pet from your home, you'll need to do a very thorough cleaning to get rid of the pet particles left behind. This includes cleaning, or even removing, carpets, sofas, curtains and bedding. Even then, it can take months for allergen levels in your home to drop low enough to make a difference. If you decide to keep your pet, or if your child's allergy symptoms continue even after the pet is gone, your doctor may recommend medications. These include saline nasal rinse. This may be enough if your child has only a mild reaction to pets. Antihistamines and other allergy medicines. Your child's doctor or allergist may recommend these for more severe symptoms. Allergy shots. These may be a good option if your child is older and has symptoms even after you've removed the offending pet and tried allergy medications. Allergy shots contain a tiny amount of purified allergen and are given over time to gradually build up your child's immunity. There is no minimum age requirement for allergy shots. You'll want to take him to a board-certified allergist who can evaluate his condition and decide whether or not shots are the best option. Other ways to manage your child's pet allergies. Having an animal in the home can provide physical and emotional benefits to your child that outweigh the problems that allergies cause. If you decide to keep your pet, here are some strategies to help keep your child's allergies at bay. Keep your pet out of your child's bedroom. Keep the door closed and the room clean. It's best to restrict your pet to only a few rooms in the house, preferably uncarpeted areas like the kitchen. Consider removing carpets. These can trap allergens for up to 6 months. Replace carpets with smooth flooring such as linoleum or hardwood, at least in your child's bedroom. Clean your home thoroughly, especially your child's room. Furniture, carpets, drapes, and even walls can trap pet dander. Consider removing heavy drapes and scaling back on the stuffed animal collection. Wash bedding once a week in water that's at least 140 degrees Fahrenheit. Encase the mattress and pillows in an allergen-proof covering. Filter the air. Consider installing filters designed to reduce allergen circulation on heating and air conditioning vents in your home, or covering them with a dense filtering material like cheesecloth. You can also run portable high-efficiency particulate air (HEPA) purifiers in your child's bedroom or other areas of the house to reduce allergen levels. Use a vacuum cleaner with a HEPA filter. This will trap not only animal dander but also dust mites and cockroach droppings. Keep in mind that it takes nearly 2 hours for particles stirred up by cleaning to settle back down. Keep your pets off the furniture. Nothing traps animal dander like upholstery. If this is impossible, or if your dog or cat has a favorite spot that you don't have the heart to declare off limits, try covering that chair or sofa with a removable cloth that you can wash easily. Change your child's clothes after he plays with your pet. If you can't wash his clothes right then, put them in a separate hamper. Wash his hands right away. In fact, give him a bath if you can. If not, make sure he gets a bath at night and wash his hair before going to bed. You don't want him tracking allergens into his bedroom. Reduce close contact. Encourage your child to avoid hugging, petting or kissing the pets that trigger his allergies. Bathe and groom your pet frequently. Twice weekly baths can help reduce the levels of dander in your pet's fur. Consult a veterinarian or other animal care professional for safe pet bathing instructions and shampoo recommendations. Have someone without pet allergies groom your pet frequently outside of your home. Can I prevent my child from developing a pet allergy? Possibly. Research suggests that exposure to animals in the first year of life may reduce children's risk of developing allergies in general. In fact, the more pets that a child is exposed to as a baby, the less likely she is to have allergies later on, according to a recent study. That said, the evidence isn't strong enough to recommend either buying a new pet or removing an existing pet from your home for the sole purpose of preventing allergies in your newborn baby. There are no known ways to guarantee pet allergy prevention. If you or your partner have allergies, your child may be genetically predisposed to eventually develop some sort of allergy no matter what precautions you take. Keep in mind that if you do have a pet, your child may not show allergic signs right away. It can take months to years of exposure before a child develops allergic symptoms in response to a new or existing pet. Are any pets less allergenic than others? Some allergists and veterinarians say yes, others disagree. Almost all animals carry allergens, so there is no such thing as an allergy-free cat or dog. Here's what we know about different animals. Dogs. There doesn't seem to be any solid evidence that some breeds of dogs are more or less allergenic than others. However, some people with pet allergies find they are more sensitive to certain breeds. Many people mistakenly believe that short-haired dogs like poodles are less allergenic than long-haired breeds. However, it's the animal's dander, not the hair or fur itself, that causes the allergic reaction. With that being said, a long-haired dog is more likely to accumulate other allergens such as pollen and dust. Cats. There is general agreement that cats are about equally allergenic no matter what their breed. Their allergens are harder to escape than dog allergens. Cat dander is smaller and stickier than dog dander, which means it can travel airborne for great distances and stick to a surface for a longer time. Since cats are always licking their fur, a child has a good chance of coming into contact with dog saliva, another common allergen. Hamsters, gerbils, and other rodents. These are also not recommended as pets for allergic children. When caged, these animals can't really avoid stepping in their own urine or feces, which can cause a reaction when they come in contact with a child's skin. Reptiles and amphibians. These are unlikely to cause an allergic reaction. However, reptiles and amphibians such as turtles and frogs can carry salmonella, a type of bacteria that can cause serious diarrhea and dehydration. For this reason, these animals are not recommended for children under age 5. If you do opt for a reptile, follow these safety tips. Wash your hands after touching the animal. Never kiss the pet. Prepare your own food away from the pet. Keep the animal in a cage or tank, away from the kitchen or dining room. An adult should clean the cage daily. Birds. This is an option for children allergic to other pets, although some kids may be allergic to bird feathers. Fish. Tropical fish are a great alternative pet for children allergic to other types of animals. Just be careful with large aquariums, which can add humidity to your home, resulting in mold and dust mites. Can children outgrow pet allergies? Yes, there are reports of children who become tolerant or outgrow their pet allergies over time. Studies have shown that high-level exposure to pet allergens can occasionally flip the immune system to eliminate a child's allergic response. This does not happen for everyone, and the chances of your child outgrowing his pet allergy are unknown. It may be reasonable to wait and see if tolerance develops, as long as your child isn't having severe allergy symptoms or difficulties controlling her asthma. Interestingly, immune tolerance may disappear if the allergen pet is removed from the child's everyday environment. For example, a teenager may develop a tolerance, go off to college, and come back home several months later only to notice that the family dog now triggers allergy symptoms once again.
Hello there viewers, in this video we are going to talk about COVID-19 cases spiking in children. During the last week of October, an unprecedented level of children, more than 61,000, tested positive for COVID-19. This soaring number of child cases follows a larger trend of spiking infections among adults as colder temperatures move more activities indoors and some people tire of social distancing restrictions. The American Academy of Pediatrics, AAP, says families must continue to take precautions to prevent virus spread, particularly as the holidays approach. Since the start of the pandemic, more than 850,000 US children have tested positive for the disease. Almost a quarter, 200,000 cases, were in October, according to data released this week by the AAP and the Children's Hospital Association. This is a stark reminder of the impact this pandemic is having on everyone, including our children and adolescents, AAP President Sally Goza said in a statement. On every measure, new infections, hospitalizations, and deaths, the US is headed in the wrong direction. It's likely many more children have COVID-19 than the data shows, because many kids only get mild symptoms and aren't tested. The most common symptoms of COVID-19 in children are fever and cough, which could be mistaken for a cold or allergies, according to the CDC. But some children do get severely ill from COVID-19 and even die. Those most at risk are children with underlying health conditions such as asthma, diabetes, or immune system disorders. Babies under 1 year old also seem to be at higher risk. Experts still don't know if COVID-19 has long-term health consequences for children infected, although a rare but serious medical condition called multi-system inflammatory syndrome in children, MIS-C, has been associated with the disease. Even if a child with COVID-19 has mild or no symptoms, they can still spread the virus to other people in their families and communities who are more vulnerable to grave illness and death. AAP officials urge people to take precautions including wearing masks, social distancing, and following recommendations from public health experts and doctors, in order to reduce the spread of the disease. Family gatherings should also be avoided if possible, said AAP Committee on Infectious Diseases Chair Yvonne Maldonado. We are entering a heightened wave of infections around the country, she said. Find out more about COVID-19 in Babies and Kids video, including symptoms, risk factors, and how to protect your family.